One of the things I appreciate about startup companies or new technologies is actually combining their efforts with physicians and the stage of the disease. As we all know, our patient populations are living longer. They have more comorbidities. So calcium, fibrotic tissue, plaque morphology differentiates. So today, hardly you would see an occlusion in SFA or pulpal T that is not severely calcified or moderately calcified. And short lesions don't really exist that much. So the need for new catheters that have significant support for the wires, support for pushability, trackability, is critically important. And if we don't have new technology like the BOSS catheter, for instance, that is able to go up and over and provide significant support for the leading wire that you're using to cross the CTO, we'll probably have a much more difficult time crossing complex CTOs because the BOSS catheter is made differently. This is the only catheter that I know of that doesn't have coiling system in it. It's made out of different material. The material that it's made out of allows it to have a one-to-one torque transmission, one-to-one pushability and trackability. And this is the one catheter that actually you just torque, and as you torque it, it propels itself forward. So you don't have to struggle with trying to push it and shove it. The other thing that it does, because of the lack of the coiling system in the wall, the gram tip of any wire that you use with it actually gets a little bit stronger every time you increase the gram tip. And that is because of the support ability of the shaft of the catheter. You'd be surprised how often we deal with a CTO that starts in SFA and reconstitutes in the tibials. And that's a nightmare most of the time. So the BOSS catheter is able to get to the CTO cap. That's easy. Getting through the proximal CTO cap depends on the C-top analogy. Hopefully, if it's a concave CTO cap, we can cross through it and get to where we need to. Now, the further away the wire is from the tip of the catheter, the less likely the wire is going to have a significant effect on the disease distally for many reasons. One is resistance, right? That's the biggest enemy for us, which leads to what we call a snake effect of wires or catheters. And the snake effect, no matter what you do when you have a wire with a snake effect, you can rotate, push, do whatever you want to do. The kinetic energy is just dissipating everywhere, but it's not going to the tip. Now, the BOSS catheter, all you have to do is just rotate it back and forth and let it slid over. It will propel itself over the wire to where you are, as long as you're confident that you're in a true lumen. You eliminate the snake effect with this catheter, the BOSS catheter, and you continue doing what you're doing, and you're going to see a significant difference in further crossing distally. If you leave the snake effect, you won't go any further. Having done primarily TBP reconstruction in most of my patients, I've learned to leverage the value of the 018 BOSS catheter in combination with the 035 BOSS catheter. Because, without the 035, most catheters that you use today or wires, they were basically snaking. So you leverage the 035 catheter by telescoping over the 018 down to the ankle or below the ankle. And now yet the 018 catheter is completely engulfed with secondary support system. So that your telescoping system is leveraged so well that the motion of the wire is so well controlled that the force transmission is directly to the tip of the wire, from your hand to the tip of the wire. You're gonna notice when you use this catheter that when you move the wire slowly back and forth, the precision is phenomenal. So you can see the pedal loop where you need to go, and you just maneuver your wire around. And once you do it once with the telescopic technique, combining 035 with the 018 BOSS catheter, you won't go back to different combinations.